Hello, my name is Shavonda Jackson. I am a BSN student with Indiana State University, and I will be doing a presentation on ethics in healthcare. Population at risk will include individuals with a low socioeconomic status, lack of knowledge of healthcare laws, limited access to healthcare, and the ages will range from 18 to 65 years of age. Learning objectives. At the conclusion of this presentation, the participant will be able to define ethics as it applies in a healthcare setting, identify ethical and unethical behavior, define and explain patient autonomy, define and explain informed consent, define HIPAA, and explain how it protects the patient. There will be a pre-test before proceeding with the presentation, and there will be a post-test at the completion of the presentation. Thank you very much for your participation in these tests. Ethics, according to Table's Dictionary, are a system of moral principles. Ethics sets the standards for healthcare from a legal standpoint, governing the behavior of physicians, nurses, pharmacists, and other licensed workers in the medical field. Ethics establishes protection for the patients for the health care received. Ethics sets a code of conduct that creates a moral and ethical foundation. Not abiding by these standards could lead to legal misconduct. Patient autonomy. Principles of ethics according to Ahmad ETAL 2020. Beneficence is ensuring patients' well-being and maintaining an individual's health. Non-maleficent is first do no harm. That means causing no harm, not injuring the patient intentionally, making sure the patient remains safe. Patient autonomy is respecting the patient's right to choose treatment options and the type of health care received, along with obtaining patient consent for any procedures or type of treatments that they may receive. Justice is legally caring for a patient by avoiding unethical misconduct. Ethical practices involve moral principles which are equality, honesty, diversity, dignity, and patients' rights. Cultural competence includes taking an individual's ethnicity and cultural background into consideration when caring for a patient and developing a plan of care. Patient-centered model focuses on the patient's needs and allowing the patient to openly voice their concerns. Family members are included in the plan of care if the patient consents. Informed consent. The patient fully understands any treatments to be performed or administered. The patient has given verbal or written consent, or a designee does so if the patient is unable to. Health data privacy. HIPAA stands for Healthcare Insurance Portability and Accountability Act, which was enacted in 1996. This act protects patients' health information from being shared without consent, and it covers pre-existing conditions, restricting healthcare plans from denying coverage. Malpractice is when a healthcare worker causes harm to a patient by negligently violating the standards of practice. An example of malpractice would be amputation of an unaffected limb, failure to surgically remove the affected limb. This would be like removing the left leg instead of removing the right leg, which was originally consented to be taken off for surgery. Failure to consent. A patient has not been fully informed of a procedure being carried out, or treatment or procedure was performed without the patient's written or verbal consent. Data breach. Patient information that is released without the patient's knowledge. Examples would be selling the patient's healthcare information without consent for personal gain or kickbacks, discussing the patient's information with a friend without the patient's consent. Positive feedback. Ethical standards that are strong helps maintain a cohesive healthcare team. Minimize harm to the patients. Allow patients to trust the staff. Educating patients about their rights will help to better equip the patient against malicious attacks. Negative feedbacks. Ethical misconduct can cause harm to patients mentally, physically, and emotionally. Healthcare providers can be legally prosecuted in extreme circumstances. Patients lose faith in healthcare workers when there are unethical mishaps. These are references that I have provided for you to go back and research if you would like to read the articles. And there will be a post test at the end of this presentation. I hope you enjoyed it and enjoy the brochure that will be posted with it.